So millions of people are turning to these powerful new weight loss drugs. But what if the side effects that we all kind of dismiss as normal are actually flashing warning signs of a life-threatening brain condition? Well, a new study suggests that might be exactly what's happening, and we're going to dive into what that really means.
Okay, so here's the central mystery. We have this rare, really dangerous neurological emergency, something most doctors would go their whole careers without seeing, and it's suddenly starting to pop up again. And the most disturbing part? The pattern of these new cases seems to be perfectly tracking one of the biggest medical trends happening right now.
So, what is this mysterious condition anyway? Let's put a name to it. It's called Wernicke encephalopathy. And here's what you really need to get. This isn't about weight loss itself. It's all about energy. Your brain is the most fuel-hungry organ you have, by far. This condition is what happens when its energy supply gets choked off at the cellular level, and it literally starts to shut down.
I absolutely love this analogy from the source material because it just makes it all so clear. Imagine that citywide blackout. The parts of your brain that need the most power, the ones that control your balance, your vision, your ability to think clearly, they're the first to go dark when that power grid starts to fail. So, the big question is, what's causing this sudden power failure? Well, the evidence is now pointing squarely at a class of drugs that has exploded in popularity.
A study dug deep into the FDA's own safety reporting system. They were looking for those rare but really serious side effects that don't always pop up in the big clinical trials. And they found a clear, unmistakable signal pointing directly to GLP-1 drugs. Yep, the same ones millions are using for weight loss and diabetes.
So they uncovered 15 documented cases of this severe brain condition in people using these drugs. And what's really telling is that most of these reports are clustered in just the last 2 years, 2023 and 2024. That timeline, it perfectly mirrors the massive, massive surge in GLP-1 prescriptions. And this chart just lays it all out, doesn't it? When the researchers actually crunched the numbers, they found that reports of this brain condition were more than twice as likely with GLP-1 drugs compared to other medications in the database. This isn't a random blip. That's a huge statistical red flag. And the outcomes? They're just devastating. Of the patients they had follow-up data for, more than half of them were left with permanent neurological damage, even after getting treated. This just goes to show that if that underlying nutrient problem isn't caught super early, the harm can be for good. But why does this happen so incredibly fast? Well, it all comes down to vitamin B1, or thiamine. You see, unlike fat-soluble vitamins that your body can hang on to for months, your B1 reserves are tiny. You've only got enough to last about 2 or 3 weeks. So when these drugs crush your appetite or cause vomiting, you burn through those small reserves at a terrifying speed. Okay, so let's get into the nitty-gritty here. How can one simple vitamin deficiency trigger such a complete and catastrophic failure in the most important organ in your body? The key player is an enzyme called pyruvate dehydrogenase, or PDH. The source material calls it a metabolic turnstile, which is perfect. Its whole job, which is completely dependent on vitamin B1, is to let glucose into your cell's little power plants so it can be turned into clean, efficient energy. So you can see this disastrous chain reaction unfold, right? First, your vitamin B1 levels tank. Then, that PDH turnstile just slams shut. Glucose is now locked out of the power plant. So your body panics and shoves it down this emergency backup pathway. And the toxic waste from that pathway? Lactic acid. Now, you probably associate lactic acid with that muscle burn you get during a tough workout. But imagine that stuff flooding your brain. It's highly toxic in there. It creates this acidic environment that directly damages brain tissue. And that's what triggers that citywide power failure we talked about. Okay, this brings us to what is, without a doubt, the most critical part of this entire discussion. What you need to watch for. Knowing these signs could literally be the difference between a full recovery and permanent damage. If you or someone you know is on these drugs, these are the symptoms you absolutely cannot ignore. We're talking about nausea or vomiting that just won't quit, any new dizziness or confusion, trouble with your balance or walking, or any changes to your vision. These are not benign side effects you're supposed to just push through. And this right here is probably the single most important takeaway from the source. So many people are told, oh, you'll feel sick for a while, it's just your body adjusting. What this study is screaming from the rooftops is that these are not normal adjustments. They are giant red flags for dangerous nutrient depletion.
So, given these pretty scary risks, what's the alternative? The author of this research proposes a totally different path, one that's focused on fixing the root cause of metabolic problems, not just masking the symptoms.
The strategy they propose is all about repairing your metabolism from the ground up. It's a multi-step approach that's really designed to work with your body's natural systems instead of fighting against them. So the first step proposed is to get off the drug to take that metabolic stress off the table. The next steps are all about repairing your gut to bring back your body's own natural appetite signals, getting rid of industrial seed oils that stress out your cellular power plants, and then, finally, reintroducing good quality protein and healthy carbs to give your body the actual fuel it needs to rebuild. And that really brings us to the final crucial question, doesn't it? These drugs, for sure, can deliver some dramatic results, but this research forces us all to stop and ask about the trade-offs. It suggests that maybe true health isn't just about the number you see on a scale, but about the hidden metabolic price we might be paying to get there. And that's a question really worth thinking about.